All good? Very good. Okay, so now we talked about the general vector, how to move the SCENAR over the body. Now, this is when you find a spot that is painful, which the patient will point out to you, or if you find an asymmetry, then you're actually working with what we call the four vectors. And the four vectors means that you go from top to bottom, from bottom to top, from left to right, and from right to left. Now the big question always is, where do you apply this? Of course, where the patient reports pain. However, let's go over this quickly. Oops. These are the treatment zones that you apply. So if a patient can point to a place and say, there's the pain, then you would actually, and that fits under the electrode of the SCENAR device because it's so small, and then you would get a treatment zone that is a little bit wider, one electrode to the top and one electron width to the side. That defines your treatment zone. If it is a larger area that does not fit under the electrode, you would widen this by the same margins, one electron length to the top and one width to the sides in all four corners. This is your treatment area. Now I will demonstrate now how to use the SCENAR in this way on a patient here. If you just come along, probably have to stand over here to be in the camera. Okay, we haven't got a chair, unfortunately, but that's all right. If you stand a little bit sideways, then I can demonstrate this a little bit better.
No.
No.
The other side, exactly, like that.
Left.
And left, please.
No.
Left, please.
To the left, not links, like that.
Where?
More, weiter. Weiter rüber.
Go from Diemen.
Me, there.
Yes, no. Yes, left. From projectors. From light of projectors. Okay.
Like that.
Okay, yes.
Tut's irgendwo weh? Tut's irgendwo weh?
Nee,
Alles gut? Alles gut? Okay.
Okay, ready.
Okay.
Here you are.
So, imagine the patient has got pain in this area here. And before we start treating, we would have asked how strong the pain is and whether there are any particular movements that would affect that pain, make it worse or make it easier. Once we figure that one out, we know it's roughly here. We would then turn on the machine, leave it on the basic settings as it is, and I would put it outside the treatment zone, which I define in this area here. And I would go outside the treatment zone and would push the SCENAR device on the skin. Because it's on level 1 energy-wise, he wouldn't feel anything. But now I will increase the energy step by step until the patient tells me he can feel something.
Good.
Okay?
Okay.
You ready with that?
Yes.
So I turned up slightly. Can you feel that?
More.
More? How's that?
More.
How's that?
More. It's
It's good like this?
Yeah.
Okay. So now we know the energy level, and in this case, it's 37. And then we would go to the treatment zone. And the treatment zone, we would apply the SCENAR like this. Put it onto the skin, and then hold it for a few seconds, and move it downwards through the lower margins, and hold it. Then we would go up and sideways for the width of the electrode, hold it again for a few seconds, move it down, and hold it again. Then we would lift it up again, go up again, and to the side, hold it, and move it again. And hold it again. Lift it up, go over one width of the electrode, hold it, move it, and hold it. Now, does that feel the same all the way?
Yes.
Okay. So then we would do this again. Go to the beginning, hold it, move it. And now I can feel something
Yes.
because here all of a sudden the device grabs and sticks. So here I found an area that we would call an asymmetry. I go over to the side, move it again. It's easier here. So basically down here is the area that is of interest. I hold it again, move it down, and here it gets stuck. So this is now where we found the asymmetry in the treatment zone. You cannot see any changes on the skin. It's all the same. It's not redder or paler, but it is sticky here. So now we apply the following. We go from top to bottom, from bottom to top.
You can move like energy move.
We will leave it at the moment to see what happens. We go from one side and on the other side. Now, what you can't see, but what I can feel is when I go this way, it's easy. When I go this way, it's easy. When I go downwards, it sticks more. And if I go sideways, it lessens already. So now you can see, there's a red spot. Here is your symmetry. And now you want to treat it so either the patient reports the pain is gone or changed, or till I feel a change. And now, as you can see, I'm gliding much easier. Before I got stuck. There's still a little bit of stickiness there. And I go in all directions again. Over it, and everything feels roughly the same or eased off. Now the symmetry is now moving a little bit. I feel it more sticky over here. So basically now it's all the same. So that's the easy way of doing it. That took me, what, 2 minutes, 3 minutes? And if the patient would have had pain, he probably would have reported the pain gone down. He didn't have pain before. However, we had an asymmetry there, and as you can see, it pales off again. Before it was brighter red, now it's coming back to normal skin color. Okay, so he starts to sweat now. So there's a reaction happening. Something is releasing that was actually indicated through the symmetry down here. Any pain now?
Yes. Better.
Better. Okay, good. So, thank you very much.
Microphone.
What's the problem?
Microphone.
Okay, sorry. We knocked it over. Apologies. table.
Cool.
It's basic. Yeah.
Yes, put it on there.
Okay.
Yep,
Okay. Yeah.
all good?
Yes.
Very good. I hope the sound did not deteriorate. Okay, so this is basically how you work with those zero mode or manual mode on an area, on a local zone, an area where the patient reports a pain. That's quite easy, quite simple. It does not necessarily work as quickly as seen in the demonstration. Sometimes it takes longer. However, the principle is always the same. You apply your general vector, you find either where the patient reports it's more sensitive or less sensitive, where the sound is changing, where the color is changing, or where it's sticky or less sticky, and you work on this area with the 4 vectors in all 4 directions. You might have noticed that the approach with the general vector is that you keep it on there for a few seconds, then you move it till you come to the boundary of the treatment zone and hold it again. This is deliberately. We are setting asymmetries by moving and holding the device, and that forces the autonomous nervous system to notice there is a difference and react better to it.
Now I've fallen asleep. Really?
Yes. There's tension, or there was tension in your back. Okay, now we release this. The autonomous nervous system is reacting, even on that little spot there, and you didn't have any complaints beforehand. It has got the effect, which are related to endorphins and neuropeptides, to calm people down. Now, there's a good reason for it. When we are in stress, as you might have been before, then you're in sympathetic mode. When you're in sympathetic mode, you are in fight and flight mode. When you're in sympathetic mode, your parasympathetic mode is switched off. But this is the mode that you need to be turned on in order to heal. So that's what happened right now. The parasympathetic is more active than your sympathetic. That's why you're feeling tired and relaxed, and things are happening as they do.
I'm feeling
Well, we can give you some 4,000 volts with the machine and wake you up again if you want to. Okay. Now, if you've been treating somebody who has the problems, say on the left shoulder, as in the demonstration, and you work and work and work, and you work with different frequencies, and you try to resolve the pain issue, and nothing really is happening, which sometimes happens, then we have got a trick in SCENAR therapy that we go to the symmetrical zone, which would mean we would have gone to the other shoulder area and would have treated there. Now, the definition of a symmetrical zone is symmetrical on a horizontal. So if you've got an able body like we just demonstrated there, is not a problem. If you've got somebody with a scoliosis, then these points do actually change. You want to have the same distance from a spine. But if you have got somebody with a kink in the spine, say with scoliosis, then you have to adjust to that, which is a little bit unusual, but it's on the horizontal, which means horizontal to the body, regardless whether the patient is straight or whether the patient is tilted because he's got an issue. And working on this symmetrical area often resolves the pain problem. And it does that because you are sending a signal to the same spinal nerve, basically, to the same areas, just from the other side, in order to distract the brain and initiate and telling the brain there is a difference between the two sides. Sometimes it is more effective to treat on the symmetrical than on the actual point of pain. So the horizontals that I mentioned, we do have horizontals as treatment zones as well. Usually, you know this picture probably from anatomy that actually gives you the dermatomes of the different spinal nerves, and you see that they are not quite horizontal, they are sloping down like this. However, in SCENAR therapy, we often use horizontals in order to tackle a pain issue, say for instance along the arm. When we work on horizontals, we always start at the spine and move the SCENAR device, for instance, along that red field, sideways all the way to the fingers, across the fingertips, and back to the front where we hold it. And if we find, by moving along this area, an area that is an asymmetry, which indicates by color, by sensation, by sound, or by stickiness, then we work on this particular asymmetry with the 4-vector method, where we go from top to bottom, bottom to top, left to right, right to left. These horizontals, of course, when you look at the anatomy, covering several different dermatomes, which is the intention of using horizontals, regardless whether we use them at the arm, at the legs, or somewhere around the torso. We're covering several dermatomes and spinal segments by using horizontals. And we always start at the back, move along and to the front, and return from there back the other way, all the way to the spine. Horizontals are 2 straight ones on the arm and an interrupted one under the armpit. So you go along there and then you come and start again at the front here. For the legs, there's a blue horizontal and a green horizontal. You go all the way around and come out on the other side and go up to the inside of the body in order to go on the back. Now here, you've got the face horizontals. There are some indications for using those ones that we come to during the day. And then we have got opposite sides, or opposite zones, where we actually have a point of pain, for instance, on the left chest at the front there. Sometimes you can treat the right back of the chest in the same height in order to have a positive effect on this painful area. These are the ways that we treat patients with local issues in dose 0 mode. And there is another type of zone that we use, which are called the reciprocal zones. The reciprocal zones are following reciprocal principles, where if you've got a pain in the front, you work on the back. If it is on the top, you work on the bottom. If it's on the left, you work on the right, and so on and so on. And what we use is actually some circles on the body, some imaginary circles, one around the head, one around the chest, and one around the belly. And these circles are actually halved and quartered through vertical and horizontal lines like that. The idea is that if you have got pain, say for instance, down here where the red spot is, on the sacrum, that you want to be as much reciprocal as possible. So this is at the bottom, so you want to work on the top. It's on the back, so you want to work on the front. If it is central, okay, you stay central. So there are different possibilities. You could choose this area here as a treatment point, which would be a reciprocal to this area. Or you can choose up here a point, because that's reciprocal to that one. Oops. And the more you actually go to the opposite side, the more effective you sometimes are. So working pain here on the face would do quite a lot to the patient as well. There are certain points that have got a reciprocal relationship. For instance, any pain in the face can be treated with working on the buttocks and vice versa. The chin and the groin are reciprocal areas. The nose and the belly button are reciprocal areas. The ears and the flanks on the torso work quite well. So if somebody's got an ear problem there, sometimes it's okay to work on the sides here, especially if for whatever reasons you cannot touch the ear. The top of the spine and the bottom of the spine, as shown here, are intricately connected. If there is a kink somewhere in the top of the spine, there must be a counter kink further down in the spine. So that makes sense from a physiological point of view already, but it is a reciprocal area for each other. Elbows and knees, arms and legs, hands and feet are actually reciprocal areas to each other as well. So problems in the hands can be treated by working on the feet on the reciprocal side. Okay, let's go further. So, to recap this, if you've got local pain, you define your local zone that you want to treat. It depends on the size of the pain. Is it just where the patient can put a finger on there and say, here's the pain? Then you've got a smaller zone. If it is a larger zone, say somewhere here, then you widen it. You check your energy level outside the treatment zone, and then you work in general vector. Once you find your symmetry or the actual point of pain, you work with the 4 vectors. If that doesn't work, you can either decide whether you want to change your frequencies or your settings on the machine, or whether you would like to work on the symmetrical point, on the opposite point, or on any other reciprocal point. These are the methods of tackling local pain and local zone treatments with the dose zero mode. After you have done a local zone treatment, you can decide, in order to stimulate the healing of a patient, with treating with general zones. Or you might have a patient who says, oh no, I haven't got any pain at the moment. Then you want to do something good for him as well. Then you would treat on a general zone. So these are areas that help the general regulation, and they are actually common to every person. With treating general zones, we can influence the body's nervous system. That's the central nervous system and the autonomic nervous system, endocrine, immune system, and the metabolism as well. We have got these 4 general zones that I mentioned before. 3 pathways, 6 points: collar zone, palm zone, and abdo zone or abdominal zone. And as I said before, when we work on the local zone and we don't achieve a change, we work on the symmetrical zone or the horizontal or the reciprocal zone. And if we still haven't made a difference, then we would go and work on the general zones.
We need 10-second break. 10-second break. We need 10-second break. Okay? No, stop.
Okay, one moment, please. We need a little stop.
Yep, I got it.
What's wrong? Рано было. Рано было.